Yeah, nice question, that one. Nice one. What's going on now is we've got a question here which says, what is done in arm lift surgery? Is liposuction performed in this surgery? Good question. This question really made me think, because I try and think about content for the website, information we need to be giving to people, because obviously I know what an arm reduction is, but people out there probably think, what's an arm reduction? I thought that's a good question, that, because arm reduction sounds like, how do you do an arm? Would you reduce an arm? What's that all about? So it did make me think that. I thought that's a good question. That maybe we need to get down into. It's hard when you're sort of a doctor and you're trying to write content for the website and give people information, because you're at sort of, you've got to get on to the questions they want to ask. That's why this is good, this Q&A thing, because it's interesting for me to see the questions people ask, because I think that's a question. It's a really good question, and it's not the sort of thing I would naturally think of sort of saying, what's an arm lift, but actually good question. So I'll answer it, shall I? So an arm lift can involve liposuction. An arm lift is a body contouring procedure, and when you strip everything back and strip everything down, it gets pretty simple. A lot of body contouring, and body contouring is arm lifts, mastopexies, tummy tucks, thigh lifts, face lifts, even. It usually involves tightening the skin, usually, and it's usually because of age. We lose elasticity in our skin over age. Things sag. Things like pregnancy can affect the tummy, weight loss, putting on weight, losing weight, your body shape changes, your skin stretches, and you have excess skin, and the surgery usually revolves around tightening the skin and improving the contour. Now, liposuction is good for removing the fat, and liposuction is good in certain areas. Having said earlier that I love doing liposuction, I do love doing liposuction. I don't do it very often, to be honest with you. And the reason I don't do it very often is because it's got an indication for certain areas. There's certain areas where it works really well. Areas like the outer thigh, I just went on my hip then, the outer thigh, the hips, the male chest. There's certain areas where when you do it, the skin recoils quite well. And so liposuction has really good results. The problem comes when the skin doesn't recoil, because liposuction doesn't do anything to the skin. I've spoken before about assisted forms of liposuction and different types of liposuction, things which do report to cause some degree of skin retraction. I don't really do them. How much skin retraction they cause, I'm not sure, because I don't do them. And I think it's often quite subtle. But broadly speaking, liposuction removes the fat and doesn't do anything to the skin. And what you need is the skin tightened often. So often the case in an arm reduction, people often want liposuction. But the problem with liposuction is that the skin is an arm reduction is for what they call bat wings or bingo wings, and it's fullness here, this bit here. Fullness in the arm is the bit from your elbow to your shoulder. The bit from your elbow to your wrist is your forearm. So this is your arm, this bit here. And it's reducing the circumference of the arm, and usually, but when you put your arms out, there's too much skin and you get these bat wing or bingo wings or whatever you want to call it. And so an arm reduction is addressing that. Now, liposuction will take out the fat, but it doesn't make the skin recoil, and the skin in that area is often quite thin. The outer arm is thicker, a bit like the thigh. The outer thigh is thicker, the inner thigh is not so thick. And so in my experience, liposuction has a limited effect. If you have a specific bulge or a problem, then liposuction might help, but really it's a skin problem. And so what I do for an arm reduction is I cut that skin out. And anytime you cut the skin out, you give a scar. Now, it's the same for a tummy tuck, same for a mastopexy, but you try and hide the scar as much as you can. Now, in mastopexy, you can hide it in a bra. In a tummy tuck, you can hide it in the underwear. It's a bit more difficult to hide it with an arm reduction, because often the fullness goes down to the elbow. So you have to make the scar down to the elbow. I don't pass the elbow, so you go just a little bit above the elbow. Now, you try and put the scar in the neutral position of the arm. So when you hold the arm out, you can't see it from the fat or the front or the back, but when you hold your arm up, you can see it. So an arm reduction is usually involved, well, in my hands, it usually involves cutting skin out. And I don't usually do liposuction. Some people do liposuction as well as, if you do liposuction as well as cutting skin out, you have to cut less tissue out because you are liposuctioning it first to empty it. And I think that's a good technique. The problem is anytime you use liposuction, it's more expensive because you have to get the liposuction equipment out. So I don't do liposuction at the time of a arm reduction routinely, but it can be done at the time of arm reduction to sort of facilitate the skin excision. But the main part of it is the skin excision. So doing liposuction alone is usually not great for